it's a very depressing time when you take a look at the temperatures.
And it's like the change of the seasons
Yep.
can bring on what's known as seasonal affective disorder. It's called SAD for short. The season changing triggers that depression.
Yeah, it's a serious thing. So how does it happen, right? For that, we turn to clinical psychologist Thea Gallagher. She's with NYU Langone Health. So Thea, welcome back. Good to see you.
Yeah, good to see you too.
Yeah, so how does this happen that just a change in season triggers depression? I mean, a lot of us, you can't understand depression if you don't have it. So help us, take us through this, since it affects up to 1 in 3% of people.
Yeah, so I mean, if you look at it, there's some thoughts that we're getting, less sunlight. We think that vitamin D has an impact on depression, right? Some, serotonin has an impact on depression. But when you really think about it also, with the dropping temperatures, you're inside more, you're less active, you're less social. It's just everything is more difficult, especially in the Northeast, right? Like you can't just go take your kids to the park in the same way that you could before. So all of the social aspects of our life changes too. And we know that those are so important, with staving off depression and with managing our mental health. And so when we lose those other pieces, it can make it really difficult. So we think it's probably a combination of things, of less sunlight, less activity, and less socializing, that kind of all come together to make it a really challenging time for people.
So when you look at it, right, what are the symptoms of SAD, and how does it differ from depression on any other day?
So it really doesn't. That's the interesting thing. It's basically like that you have depression and all the symptoms that one would have with depression, but they just tend to have a more seasonal onset. And so I know with some of my patients, they know that this time of year is historically difficult for them. And I think it's important for people to start to notice, do I always kind of tank in January? Is this always a difficult time when the temperatures go down? Because it really is, it's the same as depression. It just has more of a seasonal onset, and it might be a little bit more time limited and more predictable, which can be a good thing because then you can be prepared to manage it.
And so when we think about depression, oftentimes we think about treating that with different medications to help people with that. Is this something that you would also treat with those same medications? And are you coming on them and off them then as the seasons change back?
So some people do, and I think, that's an important conversation to have with your doctor and your psychiatrist about what would be, what would work best for you. But we also know there's a lot of really effective behavioral things that you can do with depression. And one of them is what we call behavioral activation, where you keep doing the things that bring you pleasure and joy. And maybe, you can't go swimming like you can do in the summer, but can you get outside? People ask me, what can I do when the temperatures go down? Get a warm coat, get gloves, get outside. Exercise, join a gym, be intentional with your social time, be intentional with, what you're eating and what you're drinking. Kind of just being more mindful and more present in your life and just more aware can really be helpful.
So can you help me understand, I know you talked about it already, but can you help me just kind of pinpoint? So for me, I always know that I've talked about this with you, there's always something going on in the head, right? And then someone says, well, what's wrong? I don't know. Right? And I'm not saying for me personally, but for someone, how do you know it's the seasonal thing that's actually causing you to feel a certain way compared to something else?
Yeah, you want to look, it's really important to do what we call non-judgmental observation, to step back, to zoom out of your life and to start documenting, right? What's going on? What are the situational factors in my life that could be contributing to how I'm feeling? But like you said, sometimes people are like, everything is going pretty well, but I still don't feel great. And then that can give you more data that maybe this is something that happens, when the seasons change. And also looking at your life. Like I always tell people, what were you doing in the summer versus what are you doing now? And what's different and what's the same? And maybe how can we get them to match up more? Because maybe that will help with some of these problems. But really do that documenting that can be so helpful to actually have a log of what's really going on.
And then let's talk about who might be more susceptible to this and if children are also susceptible to this.
Yeah, I mean, vulnerable populations are, anybody who's had a history of depression, history of anxiety, maybe a family history, a personal history. And yes, kids can also suffer from depression. Sometimes it looks a little bit different. In kids, sometimes it can look like anger or irritability more often. So you want to just be monitoring those things. But it's always important to look for changes and look for maybe things that start to impact functioning. Are you doing less? Are you sleeping less? Are you sleeping more? Are you eating more? Again, kind of taking inventory of what in my life is changed and how can I pinpoint kind of the things that are there. And then it's also, you go, get an evaluation with a psychologist or a licensed professional to say, hey, can you help me unpack this and figure out what's going on?
All right, a lot of information here with clinical psychologist Thea Gallagher of NYU Langone. Always good to chat with you. Thank you for being here and kind of talking it all out with us.
Yep, anytime.
Thanks, Thea.